Welcome back to my channel. My name is Becky Sechere. If this is the first time you're watching my video, remember to like. You need to subscribe, so if I post a new video, you'll be notified as well. I would like to say thank you to all of you in India, UK here who have been watching, Ghana, Kenya, Zambia, Uganda. If I forget your country, remind me. And also United Arab Emirates and Southeast Asia. I've been looking at people who have been watching. Anyway, so today's topic is from one of my subscribers. She's asked me to do a video on what are the different career paths in nursing in the UK and what specialties are in high demand. So basically, if you have trained in the UK, you would have trained in one of the 4 different fields of nursing, such as children's nursing, adult nursing, mental health nursing, or learning disability nursing. So you would start working in those areas. If you're an international nurse who have been recruited into the UK, you would also have been working in your specialist field that you were trained in, be it adult, children, mental health, or learning disability. So when you come and you finish your nursing registration, you would be doing your initial, or you will start your initial career path on the wards. And if you've been recruited by a care home, you will start in a care home. Now, after working in a care home or working on the wards after registering with the NMC, you would have gained a couple of years of experience, and you start asking yourself, what do I do next? Is that all of it? Now, moving on, career progression depends on the individual. It's usually individual choice. Some people prefer to stay on the ward because it suits their personal choices and lifestyle. Others would want to get themselves a challenge and move on. Some people like career progression. So there are a variety of settings you can move into. So you can move into community nursing and train to become a district nurse. You can move into general practice, although most practices would like to have nurses with experience in general practice. Some practices do employ newly qualified or inexperienced nurses from general practice, and they train you to do the work. Some people can train to become health visitors. It requires an extra training, a degree program or a master's program. People become school nurses. That also requires training. Prison nursing, research nursing, cardiovascular, respiratory, hematology, neurology, gastro, different types of cancer nursing, chemotherapy nurse specialists are there, diabetes nurse specialists are there as well. So that's an area you can go into. People train to become nurse practitioners or advanced nurse practitioners. So some of these require master's degree program. People can actually retrain to do things like paramedics, nurse paramedics. Nurses can actually apply to train to become doctors if that's what you want. Leadership and management is where people like, and they go into that. People go into patient safety and quality areas as well. Dermatology, specialist nursing, endoscopy, and we do have nurse endoscopist as well. And then we have nurse consultants as well. So there are a lot of different options available. It depends on you, the individual, as to what you want. Decide to stay on the ward. So when you're on the ward, you start as band 5, and then you can apply somewhere to become a band 6, which is a deputy sister on the ward. You can in future apply to become a band 7, which would be a ward manager, or a band 8A, which would be a matron on the wards, and the sky is the limit. If you're working in a care home, I know you'll be starting as a care home nurse. You can, with experience, you can become a senior care home nurse. Some people apply to become clinical leads in the care home. Others become unit managers in the care home, deputy care home manager, and people can train to become care home managers. So it depends on what you want as an individual. Also, there are several of these areas that are in high demand, like nurse practitioners, advanced nurse practitioners, nurse endoscopy. So these are some of the areas. If you have come and you have gained experience and you want to move, you can go into education as well if you want to become a lecturer. So the sky is the limit. Professional development is an individual choice. If you're willing to, you would get the opportunity to do that. So anyway, remember to like, subscribe, and share, and I'll see you in my next video next week. I've done some exercise video as well, so don't forget to watch that. Take care of yourselves and keep safe. Bye-bye.